All right, good morning, good afternoon, and good evening to all of you around the world. Welcome to this year's State of the Art in Engaging Men and Boys in Health and Development Technical Marketplace, organized by the Interagency Gender Working Group's Male Engagement Task Force. Thank you for your interest in participating in today's webinar. We had an overwhelming response with about 500 people RSVPing as of yesterday. Hence, we expect quite a crowd today. So given that, I'm going to encourage everyone to type their introductions in the chat, including name, location, and organization, as I see some of you have already started doing. As for me, my name is Myra Betron, and I will be your facilitator for this portion of the program. Sherry, you can move to the next slide, please. I serve as the gender lead on USAID's Momentum Country and Global Leadership Program, as well as JPIGO. I also serve as one of the co-chairs of the Male Engagement Task Force, along with my colleagues, whose photos and names you see here, and they will also be co-facilitating portions of this meeting. First, we have Julie Polritz. She is with Breakthrough Research and the Population Council, as well as Rebecca Lundgren, who is with the Passages Project and the University of California, San Diego. And we also have Dominic Shachek, who is one of our co-chairs. Unfortunately, he couldn't be here today because he had a conflict. He's with Breakthrough Action and the Johns Hopkins Center for Communication program, and certainly a very important representative of men amongst the co-chairs. And then we also have Danette Wilkins, also with Breakthrough Action and JHUCCP. And finally, Ann Goddard, also of the Population Council. And of course, I should also say that we have supporting us from the Population Council, Sherry Hutchison, who will be managing the logistics and helping us move through today's agenda. And I will turn it over to her for now to talk a bit about that.
Hello, everyone. We do have a presenter who will be speaking French today, and so we have an interpretation available. If you are on your desktop computer, if you go down to the bottom, you'll see a little interpretation icon. It's this globe. And if you click on that, you'll see the option for English or French. If you could please choose one of those channels, whichever you prefer, please do so. You also have the option of muting the original audio. So if you'd rather not hear that in the background, you can also mute that. Otherwise, you'll softly hear the original language spoken. Also on your mobile phone application, you also have this option. If you go to the three dots and see language interpretation, you can select English or French there. And again, you also have the option to mute the original audio. Webinar logistics, it's a Zoom video audio web conferencing platform, slide presentations. We'll do some small group interactions, breakout rooms. There's also chatting and speaking with one another, and I'll have that in just a moment. And recording, we're going to record the plenary, and we'll make that available along with the slides. And we have another slide at the end that'll go over that again. We do ask that during the presentations, please keep yourself muted unless speaking. If you could please keep your video turned off unless you're a presenter. And then the option that you can use to communicate, if you could use the chat box, which again, down at the bottom, there's a little icon with the little quote bubble. And you also have the option to give reactions, and please feel free to do that down at the bottom also. And back to Myra.
Great, thanks, Sherry. So for those of you that are not familiar with the Male Engagement Task Force, we are a network that works with experts across the globe to identify promising and best practices and gaps in research and programs engaging men and boys in health and development, with a particular focus on family planning, maternal newborn child health, reproductive health, HIV and AIDS, and of course, quite importantly, gender equality. As a network, we regularly hold these webinars to foster exchange and learning on these topics, and the experts that you will hear from today reflect a wide range of experience in health topic areas. So we are definitely in for a treat, as someone noted in the chat. We're very excited to hear from these individuals. Next slide. So today we decided to try a different format. We will be hearing from 12 different presenters and their work around the world, from Mexico to Uganda to Thailand. To really maximize our time, we decided to keep it to brief presentations of no more than 5 minutes in length. We will allow for brief Q&A between each set of presentations, which are organized along a seminal framework for engaging men in health, namely men as clients, men as partners, and men as agents of change. We also added in a fourth topic area today on the diversity of men, which will include presentations from those representing sexual and gender minorities. And then, as I said, we'll have brief Q&A between each set of presentations of just 5 minutes. So we encourage you to enter your questions into the chat as the presentations are going. I will be moderating and monitoring, I should say, the chat and taking those questions first. And then, of course, as we open up for Q&A, I will encourage people to unmute and also jump in and ask your questions after we've addressed some of the questions in the chat. But again, we don't have too much time, so we will really save the meatier discussion for the breakout rooms. We will move to those breakout rooms at the top of the last half hour, which will be about 20 minutes in length, and each of the co-chairs will be facilitating those breakout rooms. We won't have time to report back, but we will be taking notes so that we can really kind of look through those and include those in the summary of the event and share those with everyone. And then Julie will close us out at the in the last 10 minutes with some next steps, as well as more information on the task force. So without further ado, I'm going to hand it over to Sherry to move us through the first set of presentations.
Thank you, Myra. And our first grouping of presentations will be the theme of men as clients. And our first presenter, Sean Malone.
Great. Hi, Sherry. Thanks for the introduction. Hi, everyone. Sean Malone with PSI. And given the tight time, I'll just jump right in. We've been working for the last 4 years or so on understanding men's barriers to HIV testing and treatment, and developing and testing some solutions to those. And to put it bluntly, I think what came out of our research phase is that a lot of what we think we know about men might not be true. Oftentimes it feels like we're operating on some pretty one-dimensional assumptions. And I won't read through this entire list, but let me just give you a couple highlights of what we found from the research. One is that a lot of providers perceive men as stubborn and apathetic about HIV, about their health in general. And that comes from the stone-faced mask that a lot of men wear when they engage in the health space. But what we found when we gave men a safe space to open up is that although they wear that mask of indifference, they're often deeply anxious and afraid. And so we might think that we need to shake them to get their attention, but actually they're already feeling quite shaken. Another one that we found is that we often think men just need very practical functional solutions, but men told us that they experience a combination of functional and psychosocial barriers. So we need to think about men's emotional state, about their mindset, just as much as the practical considerations that they have. A third one is that we think sources of support are available, but men just are not accessing them. Men showed us in the in-depth interviews that they're very capable of opening up, but they don't see a lot of sources of support that feel safe or relatable. And then just jumping to the end, I think we often conclude that men are behaving irrationally by avoiding HIV services. But what men said is, look, the cost benefit that I'm looking at means that putting this off is entirely rational. So it's then back on us to say, how can we change that cost benefit analysis for men? We took all these barriers into a series of design workshops with men, and they told us 4 fundamental things among lots of different solutions that came out. One was, can we make it feel good to be on treatment? Right now, treatment feels like a reminder of a lot of bad things, that I failed, that I am now weak and sick and dependent on meds, that I am now damaged goods as a partner and maybe risky to my partner. And all of that leaves a lot of men feeling ashamed. But we think we could flip that and help men feel like treatment is their way of regaining control, being healthy and strong, being responsible as partners, being safe as partners. being desirable as partners, and so ultimately feeling proud and feeling good about the path that they're on. As I said, men asked us to give them the right source of support. So I'll talk a little bit more about what that might look like. The third one was, can we make HIV a collective challenge rather than something that feels like it's naming, blaming, shaming the individual that acquired it? And then lastly, can we make the healthcare experience a little more welcoming, supportive, et cetera? We looked at a lot of different solutions, and we piloted one that we think touches a little bit on all of these, and we call that Coach and Pilo. A very simple concept, taking men who are living with HIV and doing well, not only clinically, but socially. So they've processed the diagnosis, they've coped with it, they've disclosed, they're living openly and confidently, and we're pairing those with men who are either newly diagnosed or struggling with treatment adherence. And what we're hearing so far in the piloting and now early routine implementation is that men really like this because it breaks that isolation and paralysis and fear that they experience on diagnosis, immediately gives them someone that feels safe and relatable, who they know will not judge them, and provides living proof, just by the man's visual, that a man with HIV can live a normal life. We're also happy to see that this is helping coaches reframe their story. One coach said, this has turned my bad story into a great story. Another one said, last week I felt like a hero because I brought someone back who was lost. So great for coaches as well. A lot of reasons that stakeholders like it. It is not resource intensive. We can get a team together in a matter of a week, relatively low cost, paid at the same level as community health workers. It reduces stigma, which was something we hadn't entirely anticipated, but that presence of the coach we're seeing also has an effect on a man's family and community and the way that they perceive him and the way they perceive living with HIV. We piloted this in 3 districts. Yes.
Sorry, time is up.
Sorry, I didn't hear the bell. Happy to talk more in the breakout, and thanks everyone for your time.
Thank you, Sean. And if we move on to Heather Vadat, our next presenter.
Hi, everybody. I'm Heather Vadat from Male Contraceptive Initiative, and I'm going to tell you a little bit about what's going on in our field. There's a lot of partnerships brewing and a lot more activity going on in our space than folks might realize. So thank you for letting me present to you today. So first, I'll start obviously with what I know from where I am at Male Contraceptive Initiative. We are doing a lot of research and advocacy work. We're supporting R&D for the development of new non-hormonal reversible methods of male contraception. We're also working on education and getting engagement with users for seeding the field as these products come out in the future so that they'll be ready for uptake. So we are trying to do the lift around things like market research and things like that so that the scientists can focus on the science. So I'll be popping some links into the chat as I go here periodically. So the first thing I'll pop in there is an overview of our grantees and the pipeline of products that you can check out. But one of the things I really want to highlight for this is the partnerships. So from the time we sort of really kicked off our work at Male Contraceptive Initiative as a team about 3 years ago, we started seeing that there was a lot of engagement and real deep collaboration that was already present because of the collaborative grants that were ongoing with the NIH. And those are center grants or individual grants, but there's a meeting every year where everybody comes together. And so there's already a very collaborative atmosphere. So we really wanted to mark that. And so we had an ideation event to kind of challenge that and say, do we want to keep working as a community in that way? And that resulted in this paper, which I've put in the chat, which is about what we've termed team science. So this slide and what I'm presenting to you today, I think is really a beautiful view of what team science is. So you'll see the different dots represented. These are across many different organizations, not just the ones that are on the slide here. Everybody knows the challenges of getting logos approved. Some of this work is in the very early stages, but the main thing I wanted to make sure that you all understand is that we view this as a collaborative exercise, and we welcome you all into the fold of team science. Indeed, some of you may be counted already, whether or not you are aware of it. The other thing I wanted to let you know is, Sean really struck me with his comment about how one-dimensional view of men as consumers in this space are. And so the two things that we're constantly trying to challenge are those myths that men aren't interested in using contraception and that women won't trust them. So to that end, you'll see I think they're the lighter orange dots. This is an exercise that's kicked off, and data collection is supposed to start very soon. We're going to be partnering with the Gates Foundation and a group that is called Outside for Development. And what we will be doing is conducting a quantitative assessment of 19,000 men across 9 different geographies to really get at that question. This is supported by the Bill and Melinda Gates Foundation, and then MCI, we are contributing, ironically, for the inclusion of a female partner survey. So there will be a complementary survey that goes with this. And we're really hopeful that the results of this research will provide the data that we can finally definitively start changing the narrative around this. I wanted to let you know that there are clinical studies ongoing. There's the 13 ongoing hormonal studies that are being done by partners across the globe, as you can see with the green dots. And then we have our first pending clinical first-in-human study for a non-hormonal male contraceptive that's scheduled to kick off in early 2022. So there's a lot going on. We're trying to get the quantitative and the qualitative and the R&D all going in the same direction. And we are trying to really push.
30 seconds.
Thank you. Okay, push the idea of working as a community and team science. And then the last thing I wanted to share before I go is we just recently promoted or put out on our website a description of how male contraception can address some of the sustainable development goals. So that's there. And we also have a youth advisory board. So any young people around the world that you know of that would want to be engaged in these conversations, please send them my way. And thank you again for giving us the opportunity today.
Thank you, Heather. And now we can hear from Trub Farman.
Yes, good day, everybody. Thank you so much for organizing this workshop. I am Tarub Farman, the president of YHER. Today, I will present to you how we use an innovative methodology called IDEAR to enable communities to exercise their power to design their own culturally and contextually appropriate solutions to improve outcomes for men. I also would like to build on what Sean said regarding how we as providers, sometimes we assume what men want or what men need or what can they accept or what they cannot accept. So thank you, Sean, for setting the stage for me to talk about how we engage with men to improve services for them as clients. So IDEAR is a methodology that is grounded in the improvement science and behavior change theory. And we came up with this approach to improve services for men and women and close gender-related gaps. Today I will present only how we reached men, but we also reach women, we reach children with improved services. So IDEAR is a 5-step approach. And we basically build the capacity, local capacity, to identify gaps affecting health outcomes or any outcomes affecting services for men and children and women. And after the identification of those gaps, we work with communities to design locally led solutions. And we engage men and whoever we are trying to reach in designing those services. So what Sean said is very important and critical. We engage them in the design. We also work with them on the application and the continuous assessment. We use data constantly to identify whether the services are reaching them or not. And then we record and we expand services. So on the right-hand slide, section of this slide, this is an example from Kenya, we applied IDEA in 8 facilities to reach men affected by gender-based violence. As you can see, before the application, the implementation of the IDEA, the services provided for men only reached between 8 to 12, basically on average 7 men every month. And on this when we started the application of IDEA, as you can see, there is an increased number of men that were reached with improved services to address gender-based violence. Of course, there is a dip, as you can see, in January, because there was a strike among health workers, and also COVID-19 at the time affected the reaching of men. But in March, of course, we're still collecting data until this day, and we still see improved services for men affected by gender-based violence. On the slide, on the left side of the slide, this is an example from Uganda, where the teams identified gaps among men who are affected with HIV and also among children affected with HIV. And the gap that was addressed is basically to reduce the viral load suppression, basically to improve the percentage of men and children with viral load suppression. As you can see, we improved viral load suppression among men from 85% to 95%, and among children,
30 seconds.
Yes, from 65% to 95%. So as you can see, the application of IDEA worked so well because we work with men as clients. They are engaged in designing the solution. We work with influencers, local influencers who know best how to reach men. We don't assume the solution. The solutions are identified locally. So I'm going to stop here and just emphasize on the importance of not assuming what men need, but basically make sure that we reach them through influencers and design solutions that meet their needs. Thank you very much, and I look forward to the rest of the presentations.
Fantastic. Thank you all for your presentations. As you see, Sherry is being very tough on the time to keep us moving. Thank you, Sherry. And so we will see that throughout. I have not seen any questions yet in the chat, unless I missed any. If there is anyone that has a question, feel free to unmute yourself, introduce yourself briefly, and then let us know what your question is. And maybe while we're waiting to see if anyone has any questions, Sean, since we didn't get to hear your final takeaway, maybe do you want to share what your kind of key message or lesson was in the end?
Hello, Maya. Hello?
Yeah, maybe I'll just echo the point the last presenter made, which is that when we take the time to listen to and understand men, I think we find that they're not so hard to reach.
Great, excellent, thank you. Did I just hear someone unmute themselves with a question?
Yeah, I just, thanks. I just want to ask, when she talks about the influencer, how do they identify those people that they regarded as an influencer?
Can I answer this question, Myra?
Yes, go ahead, Taru.
Sure. So the influencers are identified by the local community, and we ask men who is it that they see will influence their decision and that will influence the way they approach health services. So influencers vary. We do not identify or work with influencers, the same influencers in different communities. It might be a priest, it could be a teacher, it could be the mother-in-law, it could be mothers. So depending on the community, they themselves identify the influencers, and we work with them through coaches, but when we apply the IDEA methodology.
Great, thanks, Tarub. And I see a hand up from Kola. Would you like to unmute yourself and ask your question?
I was the one that asked the question before.
Oh, I see. Sorry.
I'm sorry for that.
That's okay. Sure. So if anyone has a question, please do, when you unmute yourself, just briefly state who you are and then go ahead and ask your question.
Godfrey here. So brilliant presentations. The models are quite useful. But could we comment on when we talk about men, I think we need to be also very clear about the different categories of groups of men, and considering that they have various influences and especially driven by reputations that are associated with different age categories. So I wonder if there's any comment around that.
Myra, would you like me to answer or?
Sure, if you have a response, go ahead.
Sure, I agree with my colleague. We basically, exactly what you said is so perfect. Like we have different needs for each person. And the approach is basically client-centered because each person has a different influencer, has different needs, has different issues that they deal with, especially when it comes to gender-based violence and reaching out for and joining the HIV services or benefiting from HIV services. So again, when we apply IDEA and we work with the teams, we build their capacity to identify those gaps. This is an integral component of the process where they identify the gaps, the influencers, and when they design the solutions, we test the solutions. If a solution works, we continue working with that solution. If the solution does not work, it's immediately dropped. And that's very, very important also. I want to make that point that when we design activities, we don't wait until 6 months or a year to check whether they are working or not. There is continuous monitoring of data. Data is at the core of it. So if an activity works, we continue. If it doesn't work, we drop it. Another point is the importance of observing and applying and adhering to the do no harm policy. This is extremely important to also take into consideration when this is applied, the IDEA is applied.
Great, thanks, Tarub. Any other thoughts or responses from our other presenters? So I see another question.
Can you guys hear me?
Yes.
Hello, this is Inusia from Kenya. I just want to ask the first presenter, was that Sean? The first presenter, how do you monitor the programs? I'm very curious about your M&D system.
Sure. So what we mainly looked at during the piloting was clinical data around monthly clinic appointments and then leading up to 6 months retention. We didn't quite get to viral suppression, but we also did on the side some in-depth interviews and focus groups to learn more qualitatively what different stakeholders' experience of the intervention was. So healthcare providers, coaches, clients, et cetera, really kind of a mixed methods approach.
Super.
Great. And I'm seeing now, of course, some additional questions coming in from the chat. And I think we can certainly, hopefully, dive into some of those in the group discussions, but also, have some follow-up. But unfortunately, we do need to move on to the next set of presentations. I believe, Sherry, that's Men as Partners.
Correct. Thank you, Myra. And we will go to our first presenter in this group, and this is Manoj Paul.
Yeah, thank you very much. And hello, everyone. So my name is Dr. Manoj Pal. I am the team leader in Gender Health. And thank you for giving me this opportunity to present our learnings from a campaign that we did to broaden the accountability of men in 2 states of India, that's Karnataka and Maharashtra. So as we know that, engaging men is very important. It improves the outcomes of FP. However, data from various sources tells us that 3 out of 8 men in India do believe that contraception is only women's business. And leveraging this information, both demographic and psychographic information, we sought to develop a campaign which encouraged these men to adopt positive attitudes around family planning by increasing their awareness about its benefits, both in a long-term perspective related to their, achieving their life goals, as well as a short-term perspective, which was related to making a healthy decision in their sexual lives. The target audience for these were men who were first-time parents or were expecting a baby soon, or men who had completed their family. The approach revolved around promoting benefit of family planning in relation to romance between husband and wife specifically. The key message of the campaign being husband, wife, and love, maximize love by using FP. So this was the we used the tool of romance to promote messaging around FP, and we used a variety of media to spread information about it, which included radios, which included SMS, which included WhatsApp messages, leaflets, and street plays and puppet shows, and some games, interactive games with people, and selfie pledge booths. To top it all, there was a toll-free call center in which men and women could call, and if they had queries around family planning or around any contraceptives or anything else, they could talk to a trained person there. So all the scripts of all these were centered around the same message, that's romance, using romance as a tool for family planning. So as a result of this, we were able to reach almost 1.5 million men with 1.5 million people with SMS and WhatsApp, and there were 5,460 radio spots which were aired on in 4 FM channels in local languages. Again, in the interactive games, around 2,195 men participated, and we received quite a huge number of calls, around 6,057 calls, from which 2,661 were for men. We were also able to reach more than 30,000 men with leaflets which had key FP information centered around FP with romance. We wanted to see whether this campaign actually impacted the situation on ground, and with we conducted a survey of 400 men after 2 months of the campaign. After it's ended, around 85.5% of the men said that with this campaign they had learned new FP info, and 71.5% reported to have a better understanding of their role in FP. Again, the real outcome was in the discussion that happened between men and their partners. Almost 60% of the men said that they had initiated discussion around FP with their partners, and 31.7% of the men had initiated a condom use in the last sex that they had with their partners. Around 32% of the men said that they have started accompanying their partners to health centers to get the FP services. Additionally, one of the district governments started using the campaign logo and the message in their IEC campaign. Thus, to end this, the success of the campaign really indicates that if messages which are sensitive to men and which talk about benefit of FP and role that men can play in family planning, if these are aired, then certainly the adoption and continuation of family planning methods can be enhanced, and a clear action can be seen from this. Yeah, thank you.
Thank you, Dr. Manoj. And now we move on to Godfrey Su.
Thank you very much for the opportunity given to me to present. I know my colleague Agnes, with whom we worked on this presentation, is online. So we are very happy to present to you some of the work we've been doing on development of a parenting intervention named Parenting for Respectability, that aims at addressing outcomes associated with GBV, IPV, and child maltreatment. So the background is that most health interventions, as we know now, find it quite difficult to recruit and retain men. And we have found that parenting programs are some of the examples and they are no exception. So we know that this is quite disturbing given the sad statistics, especially around men and violence. So we have a little statistic there, just below that diagram on the left. So we see that violence against children is commonly perpetrated by fathers, 51% in Uganda. GBV, 40% of the men worldwide admit to being violent against their partner, and men are less involved in care. In fact, the care studies have indicated something between 60 to 70% of the men admit not being involved in caregiving. So we designed Parenting for Respectability, which is a 16-session parenting program to emphasize particular recruitment of male men as caregivers as much as we emphasize recruitment of females. We also emphasize recruitment of parental groups because of the advantages that are associated with both males and fathers and mothers participating in programs. This work was done between 2016 to 2020. In fact, right now we are in a large RCT in which we are evaluating the impact of this and scalability. So the content includes teaching basic skills around parental bonding and attachment, gender socialization, positive discipline, and importantly, spousal relationships. We structured the program in such a way that the first 9 sessions are single sex, and the advantage of that is that it allowed men to enroll in high numbers, and it was perhaps one of the the factors for success, because it provided male spaces in which men initially discussed concerns that bothered them, and without fear of being either blamed or being ridiculed or laughed at by women for not knowing. The second part of the program, which is 7 sessions, is mixed sex. So it brings men and women together, including parental couples. And the advantage that we saw is that it allowed clarification of conflictual perspectives. Men learned new skills from their partners and they received feedback. When we did a pre-post evaluation, the outcomes were quite promising. So 25% of the fathers reported a reduction in harsh parenting. There was an increase in men reporting positive parenting, and 22% report improved spousal relationships. The take-home message for us here is that success in involving fathers and retaining them was probably due to 2 factors. One is the structure of the program, which allowed men-only groups initially, and so they shared particular perspectives that concerned men. And then 2, harnessing pre-existing motivations on enhancing family respectability. This was our point of departure. Men want family respectability. So largely, this respectability is achieved through children's good behavior and proper or better positive relationships with their spouses. Thank you very much for your time.
Thank you, Godfrey. And now our next presenter, Erin DeGraw.
Hi, everyone. Thank you so much. I'm Erin DeGraw from the Health Policy Plus project, and I'll just jump right in. So over the last couple of years, my colleagues and I have been working on an analysis to examine the policy environment for male engagement and family planning in Nepal. And we focused on men and boys aged 15 to 24. To do our analysis, we applied a male engagement framework through a text analysis of 26 health and gender-related policies and guidelines at the national and provincial level to examine how the policies actually support or hinder men and boys' involvement in family planning. To give a little bit of information on the framework itself, it's organized around men's 3 overlapping roles. So men as contraceptive users, men as supportive partners, and men as agents of change. And it contains 27 policy provisions that influence men and boys' participation in family planning and 7 principles for male engagement that cross-cut across all 3 roles. At the end, I'll drop a link to the framework in the chat box so you can take a closer look in case you're interested. And then we supplemented this policy review and the application of the framework with key informant interviews with stakeholders in Kathmandu, Karnali Province, and Province 2 to identify key barriers and enablers for effective implementation of the policies themselves. So I won't have time to really get into the barriers and enablers that we identified because there's a lot of them. But to give a brief overview for Nepal, Nepal has positioned family planning as a health priority for the country, and its family planning framework does include provisions to reach all people, women, men, couples, and adolescents with family planning information and services. The government does recognize men and boys play an important role in couples' decision-making about the use of contraceptive methods, and that their engagement is important for reducing unmet need for family planning. However, overall, we found that the policies don't comprehensively address all 3 of men's roles in family planning and miss a number of the principles identified in the framework. So policy provisions were the strongest to engage men as clients of family planning, included several policy provisions to support men and boys' access and use of male contraceptive methods and free counseling, and also works to remove indirect costs for men undergoing vasectomy. They also included a number of provisions towards reaching adolescents and scaling up adolescent-friendly health services. However, comparatively, the policies were much weaker when it came to supporting men as agents of change and as supportive partners. A lot of times the policies included high-level statements that were not specifically targeted towards men, or if they included those for supportive partners, they didn't explicitly promote joint decision-making or strategies to more effectively communicate between men and women around contraceptives. They also didn't often take measures to protect women's autonomy as part of decision-making. On the implementation side, as you can imagine, there were a number of barriers when it came to translating the policies into programs and budgets. And one of the big things that the key interviewees responded with was that there's just a lack of leadership when it comes to male engagement. And this is both at the national and at the provincial and local levels. And they noted that as Nepal transitions into federalism, provinces and local governments are taking an increased role in and responsibility for developing and implementing health policies and programs, but they really haven't had any capacity building or strengthening in regards to male engagement and family planning. So they noted that there's almost no provincial or local level programs to engage men and boys in family planning, and there are very few funds that are actually allocated for male engagement activities. They also noted that there's an inadequate system of monitoring and accountability for male engagement.
30 seconds.
And this is a major issue for countries when they're trying to develop specific programs for men and boys in family planning. So just to close out, our final recommendation is that it's critical to strengthen capacity to develop and implement comprehensive male engagement policies across all levels of the health system. And that's actually our next step in our activity, is to build and strengthen capacity of youth-focused family planning champions to support evidence-based and locally driven action for these male engagement family planning activities in Nepal. Thank you.
Wonderful. Thank you so much. I commend this set of presenters for how well they packed in the information in their 5 minutes. I see that people have started to wake up a bit more, and we have some tougher questions and great conversation going on in the chat. Maybe the first one for Dr. Manoj Paul, could you tell us a little bit more about your methodology for the interactive games and the selfie pledge? And maybe while you're responding to that question, if you have anything to say about some of the kind of impact level outcome comparing baseline to endline.
Yeah, so interactive games we had developed with one agency whom we hired, and we can share the details of those interactive games on emails because those are long list. So yeah, and the selfie pledge, selfie pledge is one because we did some street plays, and during the street plays, people would, we had one logo of this campaign, and people would love to take a selfie after the street plays through that logo, and we would share that selfies, the photographs of the selfies with them. So in this way, we were able to garner more people into the street plays, and we were able to, keep them into the messaging loop. So I didn't get what was the second question?
There was a question about how you compared what the baseline indicators were to compare.
Yeah, so we are not comparing the baseline indicators. So what we did was, it's a pre and post campaign comparison that we do. So pre-campaign, we did not had a robust system of evaluation, and we did not have resources even for that. So in a post campaign scenario, we did a random survey of people in the localities where this campaign was done, as I mentioned, 2 months post the campaign. And then those who were exposed to the campaign, the first question was whether they were exposed to the campaign or not. And those who were exposed to the campaign, then some questions were asked regarding their usage, regarding what they did in post the campaign, how they liked it. So that way we evaluated the effectiveness of the campaign.
Great, thank you.
Yeah.
And I see another very interesting question. I think it's from Stephanie, asking about whether anyone took an intersectional approach to analyzing and designing their work to understand that men and boys are not a monolith, and therefore we must really look at them through different lenses, and she's especially interested in looking at the axis of power. So was there any of the presenters that looked specifically or kind of did their analysis through an intersectional lens to inform interventions? And Stephanie, if you want to clarify that question in any way, please do feel free to unmute yourself.
Yeah, just very quickly, because I've been primarily focused on FGM. And so there's a really interesting article that I'll look up and share with the chat. But, the article essentially points out that, again, men and boys are not a monolith. And in terms of speaking up and speaking out against GBV and harmful practices, often, things like, well, their socioeconomic status plays a role as well in terms of, their ability to champion women and girls' rights. And I was thinking about axes of power and, Heisey's flower on GBV, and this idea that, power relations are, they tend to shift and change over time, and it's it's important understanding, I guess, those power relations, depending on a program participant's role, whether they're a service provider or a member of the community. So I'm just throwing out some examples. Thank you.
Yeah, Godfrey here. Could I just comment quickly? We have not used that in our analysis, but certainly when we worked with men and we brought them together with women, and men learned some parenting skills, we saw what we all called unintended consequences of men's greater involvement in in parenting, particularly because men started to feel that they are better parents, and a number of them start to monitor what their wives or mothers of their children are doing, and they kind of intruded on sort of the female sphere, the only territory that women felt was their own, the domestic sphere. So I think, yeah, we need to pay attention to how these programs that we introduce can perpetuate inequality in different ways. And I think the intersectionality approach is relevant here to remind us of these ways of perpetuation of inequality. Thanks.
Thanks for that reflection, Godfrey. Actually, one of the questions that we put forth in the call for proposals around this theme of men as partners was exactly that, how do we promote men's engagement while still maintaining women's autonomy and agency? And so that's a very important reflection. I think it would be interesting to sort of link that also to this other question that I'm seeing in the chat from Danette. It's actually for Dr. Manoj, but perhaps others can also chime in. Very interesting to leverage the concept of romance. How do you deconstruct romance and tailor to different cultural manifestations of romance? And how do you account for couples for whom romance is not a fundamental part of the relationship and may not resonate as much?
Mara, I think, yeah, there is a cultural context to, having some, particularly having campaigns around romance, because different cultures have different, they exhibit different relationships between men and women. So we were aware of the cultural context, and that's why we could harness those specific games and activities around romance. But what we found out that this is a very powerful medium if we want to engage men specifically for FP, and I'm talking specifically for FP because our experience is specifically for that this is a very powerful medium if we start talking about it, but in a culturally contextual way. Probably our FP messaging would reach a large number of people and would impact it. That's more important. I mean, reaching is not just reach we can do by radio also, but that impact and that conversion into an action, conversion into an acceptance of contraceptives, that would be enhanced. So I mean, this is a good leverage to start working on it.
We have about a minute if there are any other burning questions that people want to jump in or comments from the presenters. Okay. I'm seeing that you've sparked a lot of interest in these games that you use, so I'm sure Dr. Manoj will share.
Yeah. So there, I can give you an example. There was one dart game. So it has all the contraceptives, and then when people use dart to throw it, they would, naturally it would fall into some of the contraceptives. And then there was a kind of person who would talk about that contraceptive, their side effects, how they can be affected. And then they would also have this leaflet. One person would be there to give the leaflets to the person. So that way, that conversation around FP started, and this was in a street level. We were cognizant of the fact that at that time COVID was also there. So that's why we wanted, not many people should be there, but still those people should come and ask about family planning. That is what we wanted. So that dart game was there. Then there were other games also. I said I can give you, details of that.
Great. And I will encourage people to continue to chat and respond to additional questions coming in. But we have another set of great presentations that I will turn it back to Sherry to introduce.
And we'll move on to our next theme, men as agents of change. And our first presenter is Unusie Ndeshe.
Hi, everyone. Can you hear me?
Yes.
Can you hear me? Yeah, so my name's Inus, and for the interest of time, I'm gonna jump direct into the program that we're running, which is Secure Future. So Secure Future program engages pregnant adolescent girls and young mothers aged 15 to 25 years and their male partners from Nairobi slums in a holistic sports-based program with the following objective. Number one, to experience increased social connectedness and support, have improved access to safe spaces, supportive network, and referral. Number two, increased critical life and parenting, motherhood skills. Pregnant adolescent girls and young mothers gain specific life skills critical for safety and well-being of themselves and their children. Number three is for them to have increased self-reliance by accessing livelihood opportunities and pathways to income generation. So far, Secure Future has been running for 3 years. It started in the year 2019. It's coming to an end this year of 2021, being supported by Comic Relief and 3 other partners, which are Women Win, Population Council, and Mom in Balance. So male engagement approach. The component of engaging male influencers were designed based on insights from pregnant adolescent young girls and young mothers who express concern about their male guardians and partners' attitude and treatment towards them. Male partners have been noted to have a big influence in the young mothers' lives and their decision making. To ensure that they influence them positively, we engage men in a Shima or respect session that teach them about positive masculinity, women's rights, violence, and child development. In addition, they take part in other forums such as mixed gender community awareness forum. They also engage through MAFIA, which is a digital text-based program for male partners to receive their female partners' personalized text messages as reminders of their due dates visit to health clinics. Secure Future program is based on the following main program activities. Number one is life skills, which is critical life skills are offered to improve young moms' knowledge, attitude, and behaviors for their own and their children's safety and well-being. Then there is sport and fitness session that focuses on improving health, well-being during pregnancy and after pregnancy. Furthermore, the fun and physical nature of sport and play offer young moms opportunities for physical fitness and well-being. Then number three, there is psychosocial support, maternal care, and referrals. Young moms get counseling, psychosocial support, and referrals to youth-friendly health and maternal facilities. Then number four, there's childcare. Daycare services and child support is offered to ensure young moms are consistent and comfortable during the program activities. Then activity number five is economic empowerment. Livelihoods and income generating activities tailored for young moms based on their interest needs to help them become self-reliant. These activities include vocational training, business training, microfinance schemes, and saving groups. Number five is male and community engagement. Secure Future engages men who are closer to the young moms to learn about positive masculinity, women's rights, violence, and child development in order to influence their safety and security. These men are also engaged in forums to give their views and contribution to the program. Secure Future's outputs are divided into various sections. Number one is employment and employability and entrepreneurship. So far, 433 pregnant adolescent girls and young moms have been offered those opportunities. And then there's mixed gender forums. So far, we've conducted 136 gender forums. Mixed gender tournament, 180 have been conducted so far. Then sport and fitness female, sports and fitness male, 626 and 80 respectively. Then psychosocial and maternal care, maternal care are 630, community members, we've done 214, male partners, 259,
30 seconds.
Male partners, 259, young moms, pregnant moms, 793. The key learning, the implementing activities that engage men closer to pregnant adolescent girls and young mothers has proven to play an instrumental role in positively changing the young men's attitude and behaviors to influencing their partners' safety and security. It has increased respect and caretaking responsibility among the young fathers and reduced gender-based violence. So I'll pause there, and then if there's any question or any information that is not right, I'm always here to avail that. Thank you so much.
Thank you, Inuse. And we'll go on to our next presenter, Elias Mwindi.
Thank you so much. I hope you can hear me clearly.
Yes.
My name is Elias Mwindi. I'm the program officer for Kenya Men Engage Alliance, an alliance of organizations working with men and boys to promote gender equality. We have a project we call the Dads and Daughters project in Migori County that is aimed at ending FGM and child marriages. And we decided to start to engage dads and their daughters with a baseline survey, which was done in 2018 in 3 villages, and we covered 151 households. And the main finding was that fathers who knew specifics about daughters' lives were significantly less likely to want her to marry before age 18 or to believe that they alone should decide when she marries. And the goals of the Dads and Daughters project was to increase dads and daughter communication and raise awareness about risks of early marriage, and have dads and daughters to be to do activities jointly, as well as help dads support daughters in their aspirations. And then we held 10-day workshops with 188 dads and 232 daughters. And the key activities during the workshops included the dads introduced each other with icebreaker, and then we had lecturettes with songs on early marriage harms, and then there were games which were played, and how do I resemble my father or my daughter. And we had they received also matching t-shirts and some other stuffs, and also given homework assignments so that they can go to do together at home. And the slogan, the Swahili slogan, which is well spoken in Kenya, for that, and we call it D&D, dads and daughters, is Baba Bora Uboresha Bindi, which is translated to better dads promote or upgrade their daughters. And some of the reactions by dads during the workshops, one of the dads is that it was my first time to sit close to my daughter and listen to her. It felt good. I am very happy today. That is one of the reactions. And the other one was that I am very excited today to learn that my daughter would like to be a doctor, because it was the first time, in fact, some of the dads had a conversation with their daughters. And it also resorted to formation of fatherhood groups, which acted as accountability mechanisms for dads to hold each other into account in case they marry their daughter early. So that is the work we've been doing. It was funded by Mundo Coprende, and some of the my collaborators included the Sixters Otieno of the Margaret Wanzo Foundation and Professor Paula Tavro, a professor at the University of California, Los Angeles. Thank you so much and for giving me this opportunity to present about our work with the dads and daughters. Thanks.
Thank you, Elias. And now we will move on to our next presenter, Jean Dedou Hatejikimana. And please make sure that you're in the right interpretation channel down at the bottom. You choose English or French. Thank you.
D'accord. Bonjour, moi c'est Jean Dedou Hatejikimana. Je ne sais pas si vous me captez, ok. Je suis de la RDC. En fait, je viens vous présenter le résultat sur la durabilité du programme IMAP qui a été implémenté en RDC. IMAP en soi, c'est un programme de changement de comportement au niveau individuel qui engage les hommes adultes à prévenir la violence basée sur les genres et à promouvoir l'égalité des genres tout en conservant la redevabilité envers les femmes et les filles. Le programme en soi, c'est un programme qui a associé 8 sessions de femmes et 8 sessions des hommes. Et puis, il incorpore intentionnellement un modèle de redevabilité entre les animateurs masculins et les animateurs féminins. IRC a mis en œuvre cette approche IMAP en RDC depuis 2016 jusqu'en 2017 dans le cadre d'un essai randomisé à méthode mixte visant à évaluer l'impact de EMAP dans les attitudes et les comportements des hommes envers les femmes et les filles. 4 ans plus tard, le personnel de l'ISC a appris que certains anciens participants à EMAP avaient continué à se rencontrer même après la fin de l'intervention IRC. L'équipe de la recherche se rendit dans la zone de santé de Rankuwa, dans le territoire de Rutshuru, en date du 29 mars au 1er avril 2021, pour comprendre mieux la durabilité d'IMAP en explorant les actions que les anciens participants à IMAP entreprenaient eux-mêmes sans appui de l'IRC. Avec la recherche qualitative faite, nous avons cherché à comprendre comment IMAP avait été maintenu dans les communautés de la RDC, 4 ans après la mise en œuvre du programme. Ainsi, nous avons utilisé des méthodes. C'était la méthode d'observation et puis la méthode de discussion en groupe. Nous avons constaté que, cependant, les motivations de ces hommes à rejoindre IMAP en 2016 étaient liées au désir de prendre de bonnes habitudes, comme le partage de responsabilités ménagères et de la prise de décision au sein du foyer, et aussi au désir d'avoir un foyer très sûr et aéré, libre de violence entre les partenaires intimes. Cette recherche s'est faite sur des sites, c'est notamment à Kabonero et à Chenyerero, où les hommes continuent à se rencontrer. Les facteurs importants qui ont favorisé la continuité du programme étaient la régularité des réunions qui étaient jumelées aux activités de VSLA, Association villageoise d'épargne et de crédit. Ces groupes VSLA ont été considérés comme un atout pour renforcer la communauté et les hommes de Tchenguerero qui ont pu utiliser ces groupes comme un mécanisme pour développer un filet de sécurité sociale pour la variété d'événements de la vie, planifiés ou non. On peut parler des cas de décès, on peut parler de mariage, comme on peut parler des cas de naissance. En termes de succès, les contenus axés sur les genres et les droits des femmes ont été bien mémorisés et cités comme utiles. Cependant, les hommes ont expliqué qu'il fallait des messages répétés pour que les nouveaux membres comprennent mieux le message clé du programme IMAP. Il est également important de noter que les hommes ont continué à subir les réactions négatives de la part de leur communauté lorsqu'ils ont essayé de se comporter de manière plus ou moins équitable en termes de genre. Nous avons également constaté que certains effets positifs involontaires, comme l'application des concepts fondamentaux à la redevabilité, à la relation des hommes avec les enfants, les hommes ont également observé une réduction du recours au vol de leurs biens de maison pour se procurer de l'alcool. Voilà ce qui a été constaté. Dans l'ensemble, notre recherche a révélé que lorsqu'il y a une adhésion et une appropriation locale au sein du groupe des hommes, les efforts pour engager les hommes dans une pratique redevable peuvent être durables et plus holistiques. Alors, pour finir, on a deux questions. La première, c'est de savoir, du point de vue de l'évolution des normes et connexion à un groupe d'hommes qui partagent les mêmes idées, est-elle suffisante pour encourager le mouvement en faveur de l'égalité des genres, même en cas de réaction négative des membres de la communauté? Et la deuxième, quels sont les risques qui pourraient nous échapper et les avantages à plus long terme? Est-ce qu'il y a des stratégies que vous pouvez nous partager pour utiliser en fait de saisir ces risques et ces avantages et que d'autres organisations pourraient également utiliser? Je dis et je vous remercie.
Okay, and then our next presenter, Khadija Asghar. Oh, wait. Did I mess that up?
Yes, I think that's Q&A now.
Oh, yes. Yeah, apologies.
That's okay. Thanks. And thanks to our last presenters for posing some questions to us as a group. So maybe before we go to that, we have some questions in the chat. I think a couple for Elias. So Danette asks, comments, it's exciting to see this model of fostering intergenerational dialogue and relationship building based on openness and compassion. Has this similar model been done with mothers and sons or dads and sons? Which is a very good point in terms of engaging young boys during formative years for when they are most, the norms development is happening.
Je ne sais pas si j'ai bien compris pour la question.
So this question was actually for Elias, and looking at the chat.
Yes.
Yeah, go ahead, Elias.
All right, thanks for the question. First of all, the reason why we did the dads and daughters is first of all because of the cultural setting, because in that area of Migori County there is the practice of FGM, and it is perceived that if girls undergo FGM, they are ready for marriage, and most of the time it is the dads who give the powers for the girls to be cut and for the girls to be married, because they will get at least some dowry. So we have not engaged mothers and sons, but we engage the fathers and the sons, because in the setting you find that boys are given more preference. They are the ones who are supposed to go to school, but the girl is looked down upon. So we were finding a way of bringing the father on board to be the change agent, so that they can stand, and because in the families, when the dad says that their daughters will not be cut, they will definitely not be cut. But we also involve women in the conversation, so we have all these people on board. We have the men, we have the boys, we have the women, so that at least we find a way of stopping FGM and child marriage. Thanks.
Great. And Elias, could you also respond to this question around any sort of follow-up evaluation that you might have done?
In fact, we had planned for a follow-up survey in 2020, but because of the COVID pandemic, we had to postpone because there were restrictions of movement. But that is what we are planning currently. We are looking for funds so that we can also do the survey and also know what has changed and what needs to be improved, so that we can come to an end of FGM and child marriage.
And I think that question also relates, if I'm not mistaken, to Jean's closing question in his presentation to the group around any sort of strategies or methods that you all recommend in terms of longer term tracking and evaluation. Is that correct, Jean? If others have any thoughts or ideas about that, I do welcome you to respond. I think Deja has helped us by restating the questions in the chat as well.
Any other question for me?
Not right now, Elias. So right now we're looking for the question that Kadeja has typed in the chat, which I think is to the broader group really for us to discuss. And perhaps if we aren't able to discuss this, because I think these are very big, important questions here in this Q&A for clarification, Jean and Kadeja, that we can discuss that in more depth in your breakout room. Okay, and maybe, so that seems like probably the best approach to go with those very large questions to tackle. For now, maybe just one last follow-up question. I think I saw here, if I can find it again. No, I'm not finding it. Yes, from Lorette. Jean, could you please say more about the negative reactions in the community and how did you deal, or the project and the men deal with it?
Merci pour la question. En fait, ce sont les hommes qui se réunissent toujours une fois la semaine. Ils planifient un programme hebdomadaire. Ils se réunissent une fois la semaine et peut-être 2 à 3 heures du cas. C'est comme ça qu'après l'intervention de l'IRC en 2017, les hommes ont continué à se rencontrer. Ils ont continué avec l'approche là de IMAP, ce qui a fait que nous soyons curieux d'aller voir comment ils évoluent. Nous avons rencontré qu'ils évoluent toujours avec le même programme que l'IRC leur avait donné. Ils ont des sessions qu'ils organisent. Mais quand ils parlent de l'approche IMAP, il faut alluser aussi au groupe VSLA. Les VSLA, c'est quelque chose qui les aide à beaucoup plus consolider l'approche dans leur communauté et aussi à résoudre certains défis ou certaines lacunes ou certaines difficultés qu'ils rencontrent au fur et à mesure. Et ils ont trouvé que IMAP, accompagné de VSLA, c'est quelque chose qui les aiderait de continuer l'approche IMAP dans la communauté. C'est ça un peu la situation, mais ils se disent que comme des défis qui sont toujours ridiculisés dans la communauté par les autres hommes qui ne font pas partie de ces groupes de discussion. Et ils veulent toujours vivre de l'égalité de sexe et de l'égalité de genre, mais il y a la communauté toujours qui agit au-dessus d'eux, en fait de dire qu'ils sont devenus des impossibles parce qu'ils vivent autrement ou en dehors des normes sociales. C'est ça un peu ce qui s'est fait dans la communauté. Et jusqu'à présent, ils continuent à se rencontrer. Merci.
Great. And I think this does speak to kind of that lesson that we know is so important in terms of social norms change, especially with respect to promoting gender equality, that we also need to really create that shift at the community level and move beyond just that group work. And I think that's sort of one of the key questions that we also had as a group of co-chairs and posed for this meeting is how do we start really getting beyond kind of that group level work to shifting norms at the community and societal level. So hopefully we can discuss that more in group as well. For now, we are out of time on this set of presentations. We have our last set of presentations on the diversity of men. I think, Sherry, we can turn to that now. Thanks, everyone.
Thank you, Myra. And Robin Dayton is our first presenter for this section.
Great. Hi, thanks everyone. I really appreciate the opportunity to be here and to present with panelists who have already achieved so much. I just want to say from the start, this is really not a story of successes already achieved, but a story of potential and what could be realized going forward. So my name is Robin Dayton. I'm with FHI 360 and I'm presenting on behalf of colleagues in Thailand, and I'll do my best to really do their globally recognized programming for transgender people justice. So in Thailand, about 1% of the general population is living with HIV, and among transgender women, this is closer to 30%. So as a result of that, key populations in Thailand include trans women, and they are one of the focuses of FHI 360's programming under EPIC and previously under the Linkages Project. So one of the main ways that we reach trans women is via trans-led organizations. There are several incredible organizations in Thailand. And one of those is IHRI Tangerine Clinic. It has, for example, trans clinicians, trans outreach staff, trans management, So this is really an opportunity for transgender people to come forward and be understood and served in a holistic way. And you can see the services that they offer here. And some of the most popular are hormone treatment and monitoring, as well as referral to gender affirming services. So for example, to gender affirmation surgery. But as you can see from the prep in the city image here, these services really do focus on trans women, and they are largely free to trans women, with the exception being hormone therapy. So because these stigma-free services really understand and contemplate trans people's experiences, they are also attractive to trans men. And over the past 7 years of implementation of linkages in EPIC, 139 trans men were registered with one of the different trans-led organizations that we partner with. 100 of these trans men tested for HIV, 4 of these men tested positive, and then another 2 were also linked to antiretroviral treatment. They tested positive in other settings. In addition, 14 of the trans men who tested negative also initiated PrEP. So you can see this number is quite small. Looking at the graph on the top right, trans men are really a small portion of those served, even when we're just looking at the transgender population. And there are not population size estimates in Thailand regarding trans men, again, because they're not the focus of HIV programming, and that's often when those size estimates are done. But what you can think about kind of as looking across the globe and different estimates that have been done. For example, in Brazil, they found similar proportions of trans men and trans women. In the US, there are about two people who identify as trans women to every 1 person who identifies as a trans man. So either way, this is a very small group in Thailand that's been able to come forward and get services. So even with this small number served, we do see that from an expanded access perspective, really wanting to make sure that men in their diversity are able to receive services, and from an HIV epidemic control perspective, where trans men in this sample had an HIV prevalence 4 times that of the general population, it does make sense to make these programs more available to trans men. And also from the perspective of engaging men as partners, the vast majority of trans men in Thailand do report that their primary sexual partners are cisgender women. So that brings me just to the final lesson. There is a lot of opportunity here. The existing holistic services that cater to trans women could easily reach more trans men if cost barriers were removed and if demand generation was tailored. So I'm really looking forward to discussing how trans men fit into the male engagement kind of rainbow of all the different interventions that we do and work that we do, and happy again to have this opportunity. So thanks so much.
And thank you, Robin. And our next presenter, Kashindi Shabani.
You can hear me? Hello? Hello, you can hear me there?
Yes, we can hear you. You can go.
Thank you very much. Sorry. So I'm speaking in English, it's okay? So I should just speak in French also. Oh, okay. So my name is Kashini Shabani. I'm from Democratic IGWG group. I just want to present our work, expanding critical health and social service for men, help sex with men in the Democratic Republic of Congo. The Democratic Republic of Congo has a weak health system and lack of basic infrastructure and social service following internal conflicts and economic threats for decades. In 2007, we estimate that HIV prevalence was among 8% among MSM in DRC. That large number is because of lack of employment opportunity that leads to MSM to become involved in sex workers in order to earn money, and sex worker in the risk because of lack of access to condom to protect them against sexual transmission. That's more than the general population. So that is about MSM. Men have sex with men continue to experience stigma, discrimination, and violence against in DRC. The lack of anti-discrimination laws mean that sexual and gender minorities, SEGM, remain unprotected and in employment, in provision of goods and service in public health and in public services. Lack of legal protection and civil rights for LGBT community. Advocates that amend the existing law and creation of new one impose the laws protect civil rights for LGBT community. Limit access include sexual health education and health critical health services and resource for LGBT community. Promoting universal access to service for all. Serving general public and government officials to do right for LGBT people living in HIV. At last, we just need to just highlight that the Democratic Republic of Congo has a great potentiality to develop a strong LGBT movement that advocates for social inclusion in all in society, in improving the ability and opportunity and dignity of LGBT community, including men who have sex with men, wherever that there is continuity of stigma barrier and addressing that purity that need for of sexual minority, such as MSM. More individual and organization committed is needed to address the overcome of barrier with time, including advocating with the government for that protection of LGBT.
Have we lost Kashindi?
You lost? No, I was finished already.
Okay, I'm sorry.
Yeah, I just finished about the lack of advocacy and then the government protection and the laws which will just look after some people and LGBT community. That's a finish about that.
Great, thank you so much, Kashindi. So we just actually had two presenters for this section. So we are open to question and answer now. If you would like to unmute yourself, or you could also type your questions in the chat.
Hi, Myra, it's Anne. I have a question for Robin. I guess I'm wondering whether you have any initial thoughts about how outreach or program design or services could be tailored or would best be tailored for trans men?
Sure, thanks, Anne. So based on the PEPFAR mandate of really focusing on trans women, the vast majority of the staff at the clinics, the outreach staff, et cetera, are all trans women. And as you saw from that Prep in the City campaign, it's very beautifully done, and everything is very much making sure that the trans women in Thailand can see themselves in all of the different promotional materials. So I think they have already done an incredible job of kind of determining what works to make trans women feel included, and that they could take those same lessons to make sure that trans men also felt included and welcome. And I think there's a ton of interest in doing that. It's that the HIV funding that comes in is very much focused on trans women. So, they already do offer, for example, testosterone in addition to estrogen. It's not that the services would need to change in terms of what they're offering. It's really about representation and also the leadership from trans men who would really be able to play a role in both implementing and designing those programs and campaigns. Thanks.
Maybe as a follow-up, Robin, could you explain why kind of the funding is prioritizing trans women?
Sure, I'm happy to. So in Thailand, the HIV prevalence among trans women is about 30%. And as you saw from the numbers I presented, among trans men, it's something like 4%. So it makes a ton of sense from an epidemiological perspective to prioritize trans women. There's also just been so much less research done with trans men that there are often not great estimates. So when I say 4% among trans men, that's just among the clients who came forward to the various clinics that we partner with. It's not a population kind of estimate across. So I would say there's both a lack of data, and actually AVAC just put forward a call for including in research studies, not just population size estimates and surveys, but things like new PrEP, like how are we making sure that trans men are also included in those studies when they weren't necessarily contemplated initially. So it follows the epidemiological information we have, but we also know that we are missing some information. And we do see from what we have that trans men are more at risk than members of the general population.
Great. I see one more question or clarification from Jocelyn. Can you please share more about what the advocacy events for MSM visibility in DRC looked like? And I think this is for Kashindi. Was there any risk to participants that had to be considered?
Sorry, can you come again with the question, please?
So the question, Kashini, is can you please share more about what the advocacy events for MSM visibility in DRC looked like? And was there any risk to the participants that had to be considered?
Yeah, okay, thank you. So we, as you know, but all LGBT communities at risk of persecution due to sexual orientation. So we're trying to do more about organizing our structure on different bases that it look like. So we are some group around of LGBT group, but we are structures between provinces. Is that I can say about that. So we try to just work under structures because it's not allowed to have legal papers to work as an organization which look after LGBT community. So we're trying to work underground to make our visibility. That's how I can say about visibility of MSM and the LGBT community. Thank you.
Right, and I encourage Jocelyn, maybe if you'd like to follow up through chat or email as well. We are unfortunately out of time and need to move to the breakout rooms. I saw that Jeanette posed a great question that I think will be good reflection for everyone as well as we move into breakout rooms, which is what does working with sexual and gender minority men teach us about broadening are engaging with the diversity of men and boys. And I think, this is a theme throughout the presentations and questions that we got, which is really trying to dig deeper in understanding what are the diverse needs of men in different contexts and settings. So I'm going to move us now to the breakout. And just as a brief explanation about what we'll do, we'll divide people up. And unfortunately, we didn't get your preferences early on, and we had so many people register, many didn't join. So we are going to randomly assign you to a breakout room along one of the 4 themes of the presentations. The discussion questions will go with the ones that we actually sent out initially in the call for proposals to present in the meeting, and those are the ones that you see here. Each one of the co-chairs will be facilitating the discussion in each of those breakout rooms. We'll have about 20 minutes, probably a little bit less now since we're a few minutes over, and you can move to the next slide, Sherry. We also have some cross-cutting themes or cross-cutting questions that we'd like you all to discuss, and those are here. And of course, you may not get to all of these, but certainly we wanted to have a starting point for a discussion. And it sounds like there's a lot of additional questions and thoughts that some of the participants have as well. So we encourage you to raise those in the breakout room.
Greetings all, and welcome back to our group session. And I will be spending the last few minutes closing our meeting. Again, my name is Julie Pullerwitz from the Population Council, one of the co-chairs. And I'd like to start off by thanking everyone as we went through this, I think, sort of exciting format. To thank first the presenters for their willingness and ability to condense their key messages into just a few minutes to enable us to have many different presenters and a range of topics. So that was so terrific. Thank you. And then thanking the co-chairs for coming together to organize this meeting and those who organized the meeting, as well as our USAID colleagues for providing input along the way. So we intentionally did not have report back from the group sessions included in our agenda so that we could permit even more presenters to share their work. So I thought I'm just going to have 2 slides for my closing remarks. The first is how to access the meeting content in the future for those of you who are looking for it. Because we did take notes during the breakout sessions, the different facilitators, and that will be incorporated as well. So there will be links to the recording of the webinar itself. There'll be access to the slide deck that was presented, and all the presenters did a great job of really condensing their work into one slide. So again, thank you for that. And an overview of each project. When the presenters submitted their summary or their application to propose presenting at the meeting today, they submitted an overview of the project as well, which we didn't get to see in this one slide. So we're going to combine those and make that available as well. So we're going to make those available on the IGWG, their Interagency Gender Working Group website, which is the umbrella group for our Male Engagement Task Force. And we're going to share it with those who registered. And here is the website for those who are looking for more information, both about this meeting as well as many other activities ongoing underneath the umbrella of the IGWG. Next slide, please, Sherry. And the last point that I wanted to make was to offer the group on the call today to become a member of the Male Engagement Task Force online community if you aren't already. So here we have a website, as you see on the bottom, which will take you to resources related to engaging men and boys in your work, including resources, many of the resources that we've been talking about today. It's also an opportunity to network with others who are working with men and boys. And then finally, to share kind of events and other I guess events and other opportunities with others related to men and boys, and particularly with a gender lens. As I mentioned, we're under this umbrella of the Interagency Gender Working Group. So if you go to that website that's on the slide right here, it will both take you to a variety of resources, but will also give you a link to a Google group where we are regularly sharing information amongst ourselves. So if you want to share an event, you want to share resources through that Google group, you can do that there. So this is not the Google group, but if you go to this link, you can join the Google group. And the last point that I wanted to highlight was around that picture on the right on this slide, to give you a sense of what the group has been doing over the last several years. A year or two ago, we as a Male Engagement Task Force group put together this short guidance around do's and don'ts for engaging men and boys in health and development. And this is intended to be sort of a really short and clear, remember to do these when you're trying to do good programming, engaging men and boys. try to avoid this perspective, use this kind of framing, and it's only 2 pages long, and it has become used quite widely and translated into several different languages. So you'll also have access to that do's and don'ts, and Danette kindly just put it in the chat, the link to it itself, and you can also get it on the website there. So that's an example of a product that kind of came out of our group itself. We tried to have probably every other twice a year meetings to be able to show sort of the big picture of the state of the art related to male engagement, such as we had today. And our last meeting focused on men and mental health. And so we also have meetings that are focused on one particular topic, particularly when it's kind of new and engaging. And then the topic before was related to COVID-19. And so I thank you again for joining us for this meeting, where we had a chance to look at a range of different activities going on across the field, across this framing that you will also see in the do's and don'ts for engaging men and boys, men as partners, men as clients, men as agents of change, or really taking into account the community-based kind of structural, how do we shift the larger community enabling environment perspective. And then that fourth question around diversity of men, as we think about how to incorporate, in particular, sexual and gender minorities into this larger umbrella around gender and engaging men. So again, I thank you very much on behalf of the different co-chairs and our larger group. And I think I'll end us here. We're just a minute or two ahead of time. So glad to end on time, despite the fact that we had 12 presenters. So thank you again, and until the next time.